more do we know then, Janice, about the case in Sweden?
We don't have a lot of information, or I don't have a lot of information, so maybe someone else does. But at the moment, we do know it was someone who came from the region. They don't seem severely ill. And the Swedish authorities called a press conference. They are certainly taking it seriously because this mutated strain is a more virulent strain. It is a more lethal strain. Marion Koopmans, who heads up the Department of Virus Science at Erasmus University Medical Center in the Netherlands, is a very experienced scientist, and she actually put out a X post saying that everyone can calm down a little bit. There have been Mpox cases every month in Europe. And it's definitely a different clade, but it's the same neglected problem. And I think what she's speaking to there is very much what the Africa CDC has been trying to bring attention to, that if we continue to neglect this problem in the areas where it's endemic, we do risk mutations, and we don't know exactly what we're working with when viruses are mutating.
OK, so still a number of unknowns and the risks of those mutations. What do we know about the containment efforts at this point? And to what extent are officials and authorities looking back at the playbook of the COVID-19 pandemic for solutions to this?
I do think that there's, in some circles at least, there's an acknowledgement that the way we did things with COVID was not ideal. But I do think equally that everyone has learnt a lot from COVID. Just on the ground example, one of the problems in Africa that countries are facing, and is a global risk, is that effectively, you've got a problem with getting vaccinations on the ground. And COVID certainly helps with ensuring that those systems are somewhat in place, and it should be easier this time around. So there are lessons learned. The World Health Organization are being they're not in the early days of COVID, for example, when asked whether this was airborne, they said no. And yet they had to backtrack on that. This week, when I asked that question on their press conference, they didn't say it was airborne, but they also didn't write it off completely. So there are lessons being learned, and unfortunately, we are seeing news this morning out of China that they're considering, I won't say closing borders, but they are certainly surveilling and more carefully if it's an inbound from the region, from Africa. The WHO and the Africa CDC have both been very clear that they do not think borders should be closed. At this stage, obviously, there is severe economic impacts.